Got about 20 seconds. So you go ahead and put your headphones on. That's is it? I think that's as short as it'll go. Sorry.
Oh, okay.
Oh no.
I'll hold it.
903. JWKLP.
And good morning. Welcome to Tuesday morning. It is July 27th. And thank you for joining us on Community Conversations on KLEK 102.5 FM. I'm your host today, Kabila Hardin, the Pink Queen. I'm kind of running by myself a little bit, but Laganzi, Mr. Cato Wonder is here in the studio. He wouldn't leave me hanging today. Okay, so I want to introduce my special guest for today, Miss Debbie Biazo. Did I say that correctly?
Yes.
She's the director of NARAN, which is the Northeast Arkansas Regional Health Network. NARAN is a nonprofit organization that assists individuals living with HIV and AIDS. As a disclaimer, based on the subject matter and level of questioning, this show may not be suitable for younger audiences, so please just use your discretion if you have little ones listening to the show. Good morning, Miss Debbie.
Good morning.
I would like to thank you for coming in today, and I'm looking forward to all of the information that you have to share with us. Before we get into that, I want you to please tell the listeners a little bit more about yourself and how you came to work for NARAN.
Well, my initial background after graduating with an accounting degree was in the banking industry. And while that seems far away from dealing with HIV, it actually gave me a good perspective on the accounting side of it and the funding side of it. The reason I became involved with the HIV population was in 1991. A very good friend of mine was involved in volunteering with the population, because at that time we saw so many individuals that were being diagnosed HIV and receiving an AIDS diagnosis at the same time. Oftentimes they received those diagnoses while in the hospital, and so many of them did not live to even go home from the hospital.
Oh, no.
So I was working with different populations, including the youth group at our church. And it concerned me that at some point HIV would be affecting those populations that I was working with, and I decided I better learn as much as I could about it.
Okay.
So this dear friend of mine got me involved in working with the population, and as a history is 25 years later, I'm still working with this population.
Oh, wow. So you must have a passion for this.
I do, because we have seen so many people over the years that when they found out they were positive, a lot of times they had to come out of their sexual orientation, and then they were practically disowned by their family members. Mm-hmm. So a lot of the individuals that we saw dying at that point were dying alone, and no one should ever have to be by themselves during that.
No, ma'am.
Fortunately, we've come a long way. Lots of changes, improvements in medication, lots of knowledge, and one of the things now, being HIV positive is not a death sentence.
Right.
HIV is being treated just as an illness, a chronic illness such as being diabetic, having high blood pressure. As long as you take your meds, take care of yourself, we're not saying how long someone is going to live, because In the last 5 years, I think we've only had one client that has died of AIDS-related illnesses.
Well, that's wonderful that the numbers are changing and that people are given a more quality life.
Yes, absolutely.
But they have to take it.
Yes, they have to take their meds.
Okay. Okay. So another question. Well, you've kind of given us a little background into your education. What other education did you have to get to be able to work with the client that you work with?
An awful lot of it is, or at that time, was hands-on.
Hands-on.
At the point that I started, the biggest qualification was you had to have a passion for working with this population.
Okay.
You couldn't be scared of them. You could not be judgmental of them.
Okay.
They were positive, and we took them where they were and helped them get from where they were to living healthy.
Okay. All right then. So, I know you said that you've been working for NARAN since 1991. How long has the organization actually been in operation?
Well, I started volunteering in 1991.
Okay.
I started working with NARAN in 1999.
Okay.
NARAN was incorporated and received their nonprofit status in February of 1992. So
Okay.
this agency's been around for quite a while.
Okay. Okay. And then what counties does, even though it says Northeast Arkansas, like what counties does the Jonesboro office serve?
Actually, we, over the last few years, have ventured way outside of Northeast Arkansas. We're currently covering 64 of the 75 counties in the state of Arkansas.
Okay.
So we have by far the majority of
Okay,
the
so
state.
are there other offices that go under the NARAN name?
We do have an office in Pine Bluff.
In Pine Bluff.
Mhm.
Okay. So there's information available for anyone. If you live in or around the Jonesboro area, please reach out. If you know anyone that is living with AIDS or HIV that may need some counseling or, information, period, just don't want to, reach out. We'll have information available on how to contact Ms. Debbie in a link on the live feed. Again, you're listening to Community Conversations here on KLK 102.5 FM. I'd like to thank you for joining in. We're speaking with Ms. Debbie Biazo of NARAN. She's the director of that program. Okay, let's move on to a question. We talked a little bit about the services you provide. Can you kind of go into like the testing, counseling, like what specifically does NARAN provide?
Okay, the first thing that we do is we do HIV screening.
Screening.
And
Okay.
what this is, it's a cotton swab in the mouth, no blood draws, no needles,
Okay.
no pain for our client coming in and no pain for us either.
Okay.
But it is a cotton swab and we do have the results within 20 minutes.
Okay.
So that takes that 1 week waiting out of the process, which is amazing relief to individuals to not have to wait that long.
Okay.
If the screening result is negative, then that's it, and the screening process is confidential.
Okay.
Now, if we do get a positive screening, then we do refer them on to either the local county health unit
Okay.
or to go to their own personal physician.
Okay.
At that point, there is a blood draw that is done, and that is for the confirmatory test. Now, I've never had a false reactive
Okay.
out of our office, but we do just want to check with this confirmatory test. Then if that one does come back positive, then the person does receive an HIV positive diagnosis.
Okay.
At that point, we start in referrals. We refer them to counseling, which a lot of the counseling we can do in-house.
Okay.
We also refer them to the physicians in their area and they make a choice as to which physician they want to follow up with.
Okay.
We do have a food pantry in our office. We also we are funded by HUD for a housing program.
Okay.
And it operates very much like Section 8. And we also have some emergency funding available for rental assistance and utility assistance. So we try and take care of the entire gamut, the housing, the food, and get them in contact with medical care.
Okay, so you offer a lot of services that are very beneficial to your clients.
We do.
Okay, so that covers a few questions that we've already knocked out. Okay, so how often would you advise people to get tested? Just, they got a negative screening, but how often, just for safety, just for their life's sake, how often would you advise to get tested?
It's on an annual basis.
Okay.
If they're participating in risky behaviors, which is unprotected sex or sharing meals, please get tested at least annually. Sometimes even we recommend that they come in every 6 months.
Every 6 months, okay. Okay. Now, during the testing process, say someone comes in and during your assessment or whatever interview process you go through, they say, oh, I've been indulging in risky behaviors. Okay, their test is negative at that time, or their screening. How soon would you advise them to come back in?
Well, we would advise them to come back in 30 days.
Okay.
Usually if they have participated in a behavior and they have the HIV virus, within 30 days, that's back reactive if they've been exposed.
Okay. I want to back up a little bit. I know some people may not know what's the difference in HIV and AIDS, and once you get HIV, you're bound to get AIDS, quickly, and you're gonna, so there's a lot of myths that are out there. So first, can we please just explain, you explain the difference? HIV, I know the V stands for virus, but explain that, and then what AIDS is.
Okay. AIDS does not have the same meaning today that it did several years ago.
Okay.
In the 80s, even in the 90s, and the early 2000s. You're HIV positive when you test positive for the HIV virus. In AIDS diagnosis, one of two things had to happen in order to get that diagnosis. It is not a separate disease. It is merely a stage of being HIV positive. And that's where it's called a CD4 count. And this is a lab test that measures the strength of your immune system.
Okay.
If that CD4 count dropped below 200, that automatically gave you an AIDS diagnosis.
Okay.
One of the other ways to get an AIDS diagnosis is if you contracted one of what was called opportunistic infections. That was thrush. In females, it also included cervical cancer, tuberculosis. There was a series of several different infections that could give you the AIDS diagnosis.
Okay.
Excuse me. In the past, an AIDS diagnosis usually meant that you had between 6 months and a year left.
Oh, wow.
Now, that is no longer the case. As a matter of fact, we do not even use AIDS so much in talking about HIV, because with the medications now, even if someone's had an opportunistic infection, their CD4 count has dropped below 200, if they get on their meds and take their meds, they can come back. Their CD4 count can come back up.
Okay.
They can remain healthy. Now, the other way that an AIDS diagnosis used to be used is the number of AIDS diagnoses was used in the funding process. Well, finally, all of the agencies that fund us have come to realize that having an AIDS diagnosis doesn't mean that they're going to die anymore. And with the medications, the majority of our clients that have been detected early, they have still not reached an AIDS diagnosis because they're remaining healthy.
Okay. And that's something I wanted to ask about. You said that, more people are remaining healthy. They, I say back in the day, people used to think if you look sick, something's wrong with you. If you had HIV/AIDS, you looked a certain way. But nowadays, you don't know. I mean, you look at someone that's the best dressed, healthiest skin, pretty hair, whatever. You would never know if they were infected with the virus or the disease. So we have to be careful with our practices, people. In this day and age, there's so many safety measures that are available when it comes to being sexually active. Of course, in a perfect world, we will teach abstinence until marriage. But, this is not a perfect world, I'm sorry. So, safe sex, people, and there's a lot more information out there on that.
Yes. And
I'm sure Miss Debbie and her staff will be happy to educate you on these different practices if you so desire to learn. Ask a question before we get closer to our break. What are some of the youngest patients, clients you've seen, and then what are some of the oldest?
The youngest one that we provided services to was 3 years old when we got her.
Oh, no.
When she obtained the HIV virus at birth from her mother,
okay.
The mother was not aware of her HIV status. So by the time we got her, she was 3 years old, maybe not quite 3. And she's doing great. She's now a teenager. Let's see, I probably got her about 12 years ago. So she would be 15 now.
Okay. Oh, that's wonderful.
Now, the other thing is just because you're a senior citizen does not mean that you're not at risk. I have a client right now that is 80 years old.
And, did they contract it through sexual?
Yes.
Means? Okay. So that means their partner either didn't disclose to them.
Exactly.
Okay, people, that's another thing. When you're dating someone, you meet someone, I know we want to go through this get to know you phase. In this day and time, because there are so many different other diseases that are incurable, I'm going to start asking those questions, those hard questions. When's the last time you've been tested? Have you been indulging in certain behaviors that can, harm you? It's time to ask those grown-up questions.
It is, and it's not a time to be squeamish. And, we have had couples come into our office and get tested together. And that's great. By the way, the testing is free.
Okay.
And we do ask that you call in and make an appointment because of confidentiality. That way we can make sure no one else is in the office at the time.
Okay. And I did want to, I'm glad you talked about the marriage thing. Say, there's a couple, they're engaged. And if this may be a deal breaker for some people, you may be totally in love with this person, but that having a disease of any kind, whether it's incurable, can affect your life.
Sure.
How soon before someone gets married would you advise them to come and get tested?
Actually, before they start having unprotected sex.
Okay.
Whether they're engaged or not.
Okay, so
they need to come in.
This goes for everyone.
Everyone.
Please get screened, get tested. If you're unsure, if you have been involved in behaviors, if you have been in a situation where you may have been raped, unfortunately, that happens. Just please, for the sake of your life and the life of your, future children or whatever, anyone else you may be engaged with in a relationship, please get yourself screened, tested, and take the necessary steps to, take care of yourself.
Absolutely, because HIV is preventable.
Yes, ma'am. And that's one thing. There's a lot of myths out there. Okay, I know this is a morning show. Take it, and that's why I made a disclaimer early on. Before I get into that, I'm sorry, we're getting close to our break, and I don't want to run out of time.
Okay.
I don't want to run out of time giving you the opportunity to answer the question. So, we're going to do a quick break. You've been listening to KLK 1.5 FM Community Conversations. I am here live in the studio with Ms. Debbie Biazo, the director of NARAN, the Northeast Arkansas Regional AIDS Network. The phone lines will open when we come back from the break. And that phone number is 870-277-1080. And this is your host for today, Quabila Harden, the Pink Queen. And we're going to take us a break. Okay, so the live one. Hey, look at thee. Let's see if we can find a smaller headset.
Oh, I'm doing fine.
Okay. Well, her headset's a little big.
I'm alright.
Okay.
I'm just hanging on to it.
Well, headset.
I'm good.
Okay.
Am I doing okay?
I mean, if I didn't run back in here, that's a good sign.
Okay. Okay, that was actually my break time. I gotta watch my time a little better. Okay, so okay, so we're going through quite a bit already. Let's see. And I put on here like in a little asterisk, like I joke to my friends that okay, when I start dating, my first date is gonna be to a clinic. We're gonna get tested. Look, I don't want to take the chance and fall in love and then find out down the line. And I know it's not fair. It's not about judging people. And it's not fair to the other person because they deserve love too. But I think I have the right to, say, I'm sorry, I don't want that for my life. I don't know, that sounds probably heartless.
Well, it's better to find out then than after you're in a relationship and then or married and then having to make a really tough decision. One of the other things that we do, especially here in Arkansas, is we do go out and give presentations and do education groups.
Okay.
Church groups, school groups, anybody that will sit still long enough and listen to me, I'll do a presentation.
Okay. And that, it's not exactly a question, but what are some ways that community members can help your activity?
Just think about it exists.
I talked about that already. Once you get into, once people have been diagnosed with HIV, are they all given the same, and I put Megan cocktail, that's not probably the right terminology. Okay. Is everyone given the same thing? And then I do want to get into where it says, once someone is diagnosed with nutrition and exercise, increase their quality of life, like their lifestyle. If someone has contracted HIV and has been undiagnosed, then later found out they now have AIDS, they're still maintaining a healthy lifestyle. Okay. Once someone has been tested or screened were positive, they've been referred to get further testing. How do you handle their partners or?
Actually, our Arkansas Department of Health does that.
Okay. I want you to tell people about that. And I actually know a lady who works for Creighton County, Arkansas Department of Health, and that she does all day, every day, contact people, try to get people to pay attention. Like, hey, doing these screenings with her. Her name is Vaughn Gretchen.
Yeah.
Okay.
Started to say, I know most of them.
Okay. She used to go to school. She's an alumni of Arkansas State University, so she lives in Marion. I think she lives in Marion. She works for West Memphis. Okay, so I want to do this. Okay, so 40 seconds. So we got people watching. And then how many types of medication? I'm making it so I know where to go. Next is my question. All right. Got about 5 seconds. Well, hello, and thank you for listening in to KLK 102.5 FM Community Conversations. I am your host today, Quabila Pardon, the Pink Queen, and I have in studio with me Miss Debbie Biazo, the director of NARAN, Northeast Arkansas AIDS Network. If you joined us for the first part of the show, she has shared a wealth of information with the listeners concerning HIV and AIDS, the testing, the screening and testing process, and what NARAN itself has to offer. They offer a variety of services that are very beneficial, so I would advise any of you, especially those of you that are sexually active, please go and see Miss Debbie and her staff, and they will get you on the right path to get screened so that you can start protecting your life and learn a few things about your overall sexual health. Even though today is not specifically a safe sex topic, we're just trying to give you some tips and to help you hopefully not contract HIV and AIDS. Okay, so we're going to move on to another line of questioning. Okay, if someone has tested positive, do you get a list of their partners and begin contacts, or is it the client's responsibility to contact their partners?
Actually, neither one.
Okay.
If someone does test positive for HIV, there is a special department with Arkansas Department of Health, and they have employees that are trained. They go out and do what is called a contact interview, and they get the either sexual partners or the individuals that they share needles with. They get their names and locations. Then those employees go out and do interviews and just talk to these partners and just simply say that they've been listed as a contact. So confidentiality is still in play here. They never know who it is that has tested positive that's listed as a partner.
Okay.
Then they try and get these individuals to come in and get tested, and so that way they will know their HIV status.
Okay. And then another question, this is going in a different direction. We've talked a little bit earlier about, even though someone may be tested positive for HIV, and then even maybe has now gone into full-blown AIDS, they still are able to live a fairly healthy life. Except for HIV/AIDS, it's not a death sentence like it used to be anymore. But okay, I have several questions. When someone is diagnosed, does the nutrition and exercise or the overall lifestyle affect their quality of life?
It does. Just like any one of us, being overweight can contribute to diabetes, to hypertension, to high blood pressure. We just ask that they do anything and everything that anyone else would do.
Okay.
Take care of yourself, exercise, eat right. Low-fat diet will go a long way in helping anybody.
Okay.
Anything specific just because they're HIV positive? No.
Okay. Okay. And then if someone has contracted HIV and has gone undiagnosed, and then later they found out they now have AIDS, is there still hope for them maintaining a healthy lifestyle? Absolutely.
What we need to do is get them tested if they haven't been. If they have been tested and just have not gotten into care, like girls, to get them into medical care. Then tests will be run to determine exactly what medications they need to be put on.
Okay.
They'll be evaluated 1 month after they've gone on the meds, and then they'll go in and see their HIV care provider every 3 months after that for routine blood work.
Okay.
Making sure that the meds are working, also making sure that the client's taking their meds.
Okay.
So there's follow-up with that. But we've had individuals that have had extremely low CD4 counts that have actually come back. Their CD4 count has increased, their immune system has improved, and I've got some of my clients that are going to outlive me.
Oh my goodness. Okay, now AIDS, the letters stand for, is it autoimmune
Deficiency, yes.
Okay, autoimmune deficiency syndrome.
Yes.
Okay, so because it affects your immune system, do you advise your clients to, I know it's in this world, in this day and age, it's hard to stay away from germs and things of that nature, but once someone has AIDS, do you advise someone how to be more careful of staying away from people with colds, flus, things of that nature, or because of the medication that they're on, does it actually help them not get as sick so quickly?
The medications will improve their immune systems.
Okay.
So, yeah, everyone wants to stay away from people that have flu. One of the things that we used to really stress in the 80s and 90s is stay away from chickenpox.
Okay.
Because shingles is something that we've all heard a lot about, and with a compromised immune system, shingles is something that can just be horrible for our clients,
Okay.
as it is for anyone else. So most of them do also get the shingles vaccine. They also get the flu vaccine and also pneumonia, the pneumovax. So there are vaccines that can help them prevent from getting some of these issues that aren't necessarily life-threatening, but they do cause a lot of problems.
Okay. Alrighty, for those of you that are listening in, I just want to remind you that we're talking with Ms. Debbie Biazo, the Director of NARAN and the Northeast Arkansas Regional AIDS Network, here on Community Conversations on KLEK 102.5 FM. We're open to taking your calls, or if you have any comments or questions for Ms. Debbie at 870-277-1080. Okay. I want to get into a question concerning medications. We talked a little bit off air. Once someone's diagnosed, is everyone given the exact same medicine cocktail, or is it, specialized based on that person's health?
It's going to be specialized based on that person. There are several different medications that are out on the market now, and work is done. It's called a genotype, and that will tell the physician, the HIV care provider, if that individual is resistant to any of the medications. So that way everything is set up specifically for that individual. Now, yes, the medications are out there and the wonderful, but they're not without their price. The average cost of medication for 1 month for a healthy individual is going to run about $200. So that is a staggering amount, and at least now we have more insurance available to individuals in the state of Arkansas. But even to help with some of those costs, there are some income guidelines that would make you eligible for other services. And so we do make sure that everyone is hooked up with those services so that they can get help. And most often, the HIV meds will come at no cost to the client.
Okay, so for those of you who are questioning on medication, even those of you now who may agree with these diseases, it's okay to go talk to someone. If you're having some issues, you just need to talk to someone. There's another question I want to get into about how people are changed psychologically. No one ever wants to receive bad news. You know, you have diabetes, you have heart disease, you have cancer, you know, you have HIV/AIDS, or AIDS. I'm sorry, I need to change my dialogue. That HIV and AIDS, even though they're linked, they're still two different. There's still two different types of diseases or viruses. I'm sorry.
No, it is the same virus.
Same virus.
Just that to get the AIDS diagnosis, your immune system has to be compromised to a certain point.
Okay.
And our goal is to keep everyone from getting to that point.
I apologize for
No
getting those mixed up like that. Okay. So let's talk about the psychological aspect. You mentioned, you know, beforehand we were talking, you know, some people get mistreated by their family. They get shunned. Of course, get shunned by society. How do you help people deal with their psychological issues?
Well, first of all, I'm going to talk a little bit about the staff at our agency. I do have a licensed counselor. Okay. And he has been with the agency for over 2 years now. He is a social worker. LCSW, graduated from ASU. Okay. And so he can sit down and talk with them from more of that aspect of their lives. Now, I have a lady that works for me, and she's also been with the agency for more than 10 years. She is also a social worker. Okay. We do have a health information graduate that has just recently joined. And then I've been with the agency for 17 years. We can all discuss different aspects of this with the client. One from healthy eating and healthy lifestyle, one from more the psychological part of it, and then one from more the medical end of it. So we've got all of those different areas covered. A lot of times we just have to sit down with them and do some basic HIV 101 education because there are still so many misconceptions out there. You know, I still have family members ask, well, can I catch it from them from going to the bathroom after them? Can I catch it drinking after them? No, you can't. And there was one episode one time when I had a family member that just really was adamant that her son had to go because she did not want her dogs to catch HIV virus. And so sometimes I have to put on my blunt hat and go, this is a human virus. Your dogs are not going to catch it, but that is still just part of the misconceptions that are out there. One of the other things that we do have is we have a monthly support group that meets at our location, and it's open to anyone that is HIV positive, so they can come in and talk to others that are also HIV positive. I can sit there and talk to them all day long and give them exactly the same information, But if they're hearing it from another person that's HIV positive, it gives a whole different perspective to them.
Okay.
And from these individuals, and some of them are very long-term survivors, anywhere from 18 to 22 year survivors.
Oh, wow.
They can learn that I'm not going to die. You know, I can choose to if I shut down and let it happen. But if I want to live and I want to be a survivor, I can be.
Okay. Yes, ma'am. Now, you mentioned before, before I get into the community aspect, I want to, end on that note. Okay, we talked about the confidentiality.
Mm-hmm.
Do you have measures in place to monitor, say, your computer system, just to make sure the information is not being leaked? Or do you have a way to monitor your employees? I'm sure those that have been there over 10 years are familiar with the program and are, passionate about what they do, and they hold everyone's they earn your client's trust.
Yes.
So they don't want to do anything to jeopardize that. But do you have a way to kind of monitor?
Well, there's several different things. First of all, for the two that are social work graduates, there are heavy ethics standards of a social worker. We also have confidentiality agreements that every employee must sign in order to do care. We have also done background checks at times. We are very particular about who we hire. So that makes a big difference too.
Okay. And I'm sure that you probably don't see a lot of turnover. It seems that once people are hired, it's like, obviously they joined your company for a reason. They joined the organization for a reason. They want to help people. It's not some position you just get into that you're just passing through.
No, and through the interview process, we go over that a lot. Why do you want to come and work here?
Okay.
And if we even pick up on the modus possibility that all they're looking for is a job,
No.
they're not considered, because this isn't a job. This is something you've got to want to do it.
And I'm sure that you take a lot of your cases home with you. How do you deal with that?
Sometimes you can compartmentalize it.
Okay.
The other things is we are such a small staff that we talk to each other. So we're our own best support system and network system. And for me personally, I happen to be married to a therapist.
Okay. So you get a lot of free couch time. I would love to be married to a therapist. I don't know. I'm not psychoanalyzing all the time. Okay. Have you ever had anyone, they come in for a screening, they tested positive, and you give them a list of referrals and you give them a list of steps they need to take from this point on?
Mm-hmm.
Has anyone ever refused your services?
I can only think of one.
Okay.
And there was something going on in his life other than HIV.
Okay.
He was terminally ill from another disease.
Okay.
And so, it's one of those things. HIV technically is not what ended his life.
Okay.
So, rather than start in on the medications with some of the side effects, he was already going through chemo, so he did not start the HIV treatment.
And do you require that people sign a waiver of any kind saying that they were screened, they tested positive, but they refused your services?
We do not have them sign a waiver. Now, Arkansas Department of Health that goes out and does the contact interviews, they do have individuals who tested positive to the Western blot test, and they do have them sign that they have been made aware that they are HIV positive. We do follow up with them and make sure that they did not into any barriers that prevent them from getting into services.
Okay.
And if there were any barriers to care, we work with them to eliminate those.
Now we talked off air a little bit about statistics, and I was just interested in knowing. I would love for the community to know how has the statistics changed over the years since you've been working in this program?
When I first started working, it was basically the gay white male population that was being infected with HIV and receiving the AIDS diagnosis. That has changed drastically over the years.
Okay.
It is disproportionately affecting minorities, the African American and the Hispanic populations right now. There's no set age that we're seeing right now. It's affecting everyone of every age. We saw an increase in women of childbearing age for a while, and they were finding out they were positive when they went in for prenatal care. So we were seeing that. Then in 2014, the state of Arkansas saw the highest number of new diagnoses of HIV that it has seen since 1995. The AIDS diagnoses have decreased drastically. The percentage that are getting an AIDS diagnosis is very small now, but the number of new diagnoses of HIV is very much on the increase.
Do you think it could be because of, we're going to get ready to take a break here soon, but I want to ask real quick, do you think that the numbers are changing because people are just getting more relaxed in their sexual practices?
I think they are, and also knowing that if they are HIV positive, there is medication out there has kind of caused an apathy about it.
Okay. Alrighty, you're listening to KLK 102.5 FM, Community Conversations. We'll be right back. Says what it says. Okay, so.
Yeah, right now, Vila's on with like here from NARAN.
Hi, I'm Debbie. Hi, David.
Nice to meet you.
Nice to meet you.
I just want to say hi.
Appreciate you stopping by. Dr. Taylor, why don't you get a couple tickets for our blues show?
Okay. The next break, and this is what confused. Okay, it's like 5 minutes. It says 5 minutes. What is the outro? I'm learning this timing. I'm trying to, because if I'm still talking, no matter if I'm still talking, whatever's programmed to come in and say it's going to come anyway. So I need to make sure that I'm not talking when music is going out. Okay, so what we want to get into this last few moments, then we talk about how the community can be more involved, volunteer opportunities, where you're located. We can talk about where you're located. So we need to give that information, dates and time, or definitely more information about the support groups. So support groups, location, volunteer opportunities, and then setting up community events. I work with a group of teens at my church, and I try to talk to them about I don't want to drill abstinence, which, from a Christian perspective, that's what we're supposed to be teaching. But in reality,
Abstinence CDC is finally.
so that why they don't do abstinence only education. But years ago, I was involved with a program. It's called Making a Difference. There was a program that was presented through the health classes in the junior high. And I was invited to come in and talk about teen pregnancy at the time.
Okay.
And that's how I remember your name, Miss Rebecca. And so I was cases, and I was also a teen. I guess I was 19. So because I had that experience, I was able to share with the junior high students. The program eventually fit out, and I noticed okay, the lady who ran the program, she would always every year host some type of big awareness, abstinence awareness day, teen pregnancy prevention, something. You don't see that anymore.
No, Center for Disease Control finally figured out that teaching abstinence only was not doing any good for teen pregnancy or for STD prevention. And so they started using different programs.
Okay.
For whatever reason, it's just not being done that much in the state of Arkansas, and that's a shame.
Do you think it needs to be picked back up again, or needs to be an increase in some type of education?
It is.
And because I'm not in the industry anymore, I don't know what the teen pregnancy numbers are, and I'm sure it's probably a little overwhelming right now. Oh, mercy. One of my girls tells me that she's about to be a junior this upcoming year, and she already knows some girls are already pregnant that'll be going into the school year pregnant. Okay, there's more to do in the summertime.
Yeah.
Well, we got programs with these children involved in.
Yes.
40 seconds. We need to find, and this is where I come in. I love working with adolescent population. Planning on going back to school in January to finish my degree in sociology. I love working with adolescents, mainly teen girls. I don't know, some people are like, yeah, I feel like based on my life experience, I feel like I can offer them a wealth of information. And I'm not their mother, my children, like my son. If I'm talking, not true. Hello and welcome back to Community Conversations. I am your host today, Biazo, the Pink Queen, along with Ms. Debbie Biazo, the director of NARAN, the Northeast Arkansas Regional AIDS Network here in Jonesboro, Arkansas. And I can't thank you, Mrs. Debbie, for joining us in the studio today.
Thank you for having me.
You've been giving us some wonderful information, and I'm taking all kinds of notes. I hope that the community is listening, and I hope that people are taking notes. I hope they're thinking more about their lifestyle, and I hope that they are making plans to go get those screenings and testing. And we're not trying to tell you how to live your life. We're just trying to give you the information and education to hopefully help you make better choices.
Absolutely.
We're not trying to browbeat you. Safe sex, and most definitely yes. I mean, just think about, for those of you women, like Miss Debbie mentioned before, they saw an influx in the numbers and cases among women who are in the childbearing ages. So just think about, if you want to get married, if you want to have children, to learn how to protect yourself and protect the life of your child, because as she has also mentioned, some children are born with HIV, and that could have been prevented if the mother had taken preventative measures beforehand, maybe getting her partner tested and making sure that he was clean. So there's a lot of things you can do to prevent yourself from getting HIV and AIDS. Okay, so before we run out of time, we have 3 minutes left. I want Debbie to go into a little more information. First, we never told you where they're located, so please give us that information.
Okay, we are located at 2919 East Matthews.
Okay.
And our phone number is 870-931-4448. And just give us a call, let us know what your needs are, and we'll take care of it.
Okay, again, that phone number is 870-931-4448. And please don't be shy about going to get tested, getting screened, and talking to Ms. Debbie and her staff about the options that are available for you. Okay, you talked about your monthly support group. When is that held and where is that held?
It is held at our office, and if this is something you're interested in, just give our office a call, and we'll get you set up with that.
Okay. Now, do you have volunteer opportunities available?
Normally, no.
Okay.
And the primary reason for that is confidentiality.
Okay. Well, on the flip side of that, you talked about you will be willing to come and talk at community events if someone is willing to set up a session.
We come and we talk at health fairs, any civic organization, any youth group. I've always joked, I'll come and I'll talk to anyone that'll sit still long enough to listen to me.
Okay.
Because this is the way we get good factual information out in the community.
Okay. And before those, I want to please give people just a little tidbit on the passion. Like, if you're going to work in this industry, why? Like, we have about 20 seconds.
First of all, you've got to care about people. You cannot be judgmental. We deal with prostitutes, we deal with individuals who have come out of prison for murder, sex offenders and everything. You just cannot judge people.
Okay. Listen to the last little